All right, so let's jump right back in. So we just looked at control group or experimental conditions. So now let's look at control group conditions. So for the control group, either no intervention is used, so they get no treatment at all. They get the standard or normal care that you would normally use to treat patients, which, as we've talked about with CLABSIs, in my experience, the control group would get the old dressing that we thought might be causing the problem, but we aren't sure. The new group would get a new dressing, and we would compare the two. An alternative intervention might be used, or a placebo or a pseudo intervention, or a lower dose or intensity of treatment, or only part of the intervention might be used. Also, for control group conditions, sometimes there's what we call attention control. So they get extra attention just to account for that. If they're not getting anything, then sometimes that affects the outcome because they know they're part of a research project. They realize they're not getting anything, and so sometimes just that knowledge can cause difference in the outcome. So they might get attention, but not actually the active ingredient of the intervention. Or they may get delayed treatment. So just like we talked about on that design where you gave the intervention to the first group and then you switched and gave it to the second group, it would be kind of the same thing. The symbolic representation is the same. The first group gets the intervention and the control group gets nothing, but then later the control group gets the intervention. So this is kind of a waitlisted type thing. So the advantages and disadvantages of experiments. The advantages is they're the very most powerful type of experiment we could do for showing cause and effect relationships. So they're very strong evidence for us. The disadvantage is that they're very time consuming and hard. They're sometimes not feasible or ethical. We've talked about a lot in class about depression and how we measure that. You can't do a true experimental design looking at, and your intervention be depression. That would be a non-experimental design because we don't want to give people depression. Another one that the book uses a lot is smoking. We're not going to make people smoke, so we can't really truly randomize if we're studying smoking. The Hawthorne effect is what I was just talking about, is that people who know they're in a study may change their behavior just because they know they're in a study. That can affect things. And then often it's expensive to do these kind of experiments just because there's so much to them. So now we go down to the next step, which is quasi-experiments. And you're going to see a lot more of these in nursing. They do have an intervention, but they usually either don't have randomization or they don't have a control group. And typically it's randomization. So the two main categories are non-equivalent control groups. So those getting the intervention are compared with a non-randomized comparison group. That may be like in the hospital using one floor to implement the intervention and another floor to be the control group. It's not randomized. We're using everyone that comes on this floor as the intervention and everyone that comes on this floor as the control group. But we're going to look at the comparisons. Or you can use a within subjects design where one group is studied before and after the intervention. So you're comparing that group among itself, kind of. So non-equivalent control group designs are these first two are actually the non-equivalent ones. So you have the groups. One of them gets the intervention and one doesn't, but the groups are not, so it looks just like the randomized, but these groups are not randomized. It's who you have available to you a lot of times. This one is pretty weak, the post-test only, because you can't tell. If you do the pretest, you can tell how similar these groups are before your intervention. If you don't have a pretest, you have no way to determine if the intervention caused the difference in outcome between these two groups. So that's a really weak study. You try not to do that. Now, if you're doing the one group pretest, post-test, then you have the one group. This might be something we would do in nursing school. We have one group that we say flip the classroom. You guys all love that. So we flip the class, or we have this group. We give them some kind of survey or test. We flip the classroom. Then we redo the survey and test, and we compare the previous results to the results after the intervention. So that's the way you would do that with just one group. The time series design is over a longer period of time. So we're collecting data and collecting data and collecting data and collecting data. Then we do the intervention, and then we collect data on out to see what the effects are. So that one is a little more, takes a little more time, but it probably gives a better representation of, does that intervention really cause this effect that we're looking for. So advantages and disadvantages of quasi-experimental. It's going to be easier and more practical than true experiments. Like I said, for schools of nursing and things like that, a lot of times this is our only option here is the quasi-experimental type designs. In the hospital even, quasi-experimental designs are what gets done because it's cost-saving and it's more practical. But they do make it a little more difficult to show causality because you don't have those randomized groups. And a lot of times there's several rival hypotheses for the results, and it's because of this. There's those extraneous or confounding variables that could have impacted the outcome instead of the intervention that you're looking for. So you have to really discuss those in your research and how those were controlled, or what we believe happened with those, and to prove that this is what is the outcome from the intervention that we implemented. So the third type is non-experimental studies. So this is if researchers don't intervene by controlling the independent variable, the study is non-experimental. So, a lot of these can't be manipulated. We talked about this in class just yesterday with the Durant group. Gender has an effect on a lot of different studies, but you can't manipulate that. So this would be a non-experimental study if we're looking at the effects gender has. Smoking, I mentioned this earlier, can't be ethically manipulated. So neither can depression or anxiety or fear. We can't ethically manipulate those things. So we have to use non-experimental studies to get the results from these. So the types of non-experimental studies that you may see are correlational designs. And these are usually like prognosis or harm etiology type questions for where you can't manipulate. So it looks at those without manipulating the independent variable. So you're just looking at the association between the variables, and this has to have really good statistical analysis to be able to do this. So, for example, in a prospective correlational design, what you're going to look at is what's happening in the present might be linked to something that you're thinking will happen later on. So the example here is experiencing versus not experiencing a miscarriage is linked to depression 6 months later. So a lot of times you'll hear researchers call this a cohort study because you're looking at a specific group of people. Obviously, they're not randomized. You're looking at people who have experienced or not experienced a miscarriage, and then you're going to hypothesize whether they're going to be, suffer from depression later. Prospective studies are strong in looking at causes, but they're better than looking back. So it's looking forward, it's better than looking back, but they're not as strong as experimental designs. And you can say that for any other research, nothing's as strong as an experimental design. Retrospective, again, is looking back. So you're going to look at, in that example, people who have depression and look back to see if possibly they had a miscarriage in the past. So retrospective, we're looking at call them case control design. So you look at cases or people that it's not really an intervention, but they had this thing. So maybe they were smokers, or maybe they were lung cancer. They have lung cancer. People that don't have lung cancer. And then you look back and say, who out of these two groups smoked? Could we link smoking with lung cancer? Another type of research is descriptive research. And this isn't necessarily probing or going into, it's just trying to describe something. So you're just describing that variables are related, but not really saying there's a cause and effect. You're just saying there's a relationship here, but we're not, may not be sure what that relationship is. But this is a good place to start sometimes in research if you have this phenomena that's like no one really understands or knows anything about. You can do some descriptive research and determine that, okay, there is a relationship here, and then carry it further into some more in-depth research to determine what that relationship is. So, for advantages and disadvantages of non-experimental research, you can get a lot of data, and like I said, it's very good, those descriptive studies for things that we don't know a lot about, or where we can't randomize or we can't do an intervention. It's really good, but it doesn't tell us a lot of cause and effect things. It's kind of a beginning place for research. Gosh, I'm about to run out of time again. Time dimension. Cross-sectional is looking all at a single point in time. Longitudinal is over extended period of time. In longitudinal research, there's some very interesting studies that I remember from seeing on TV back when I was younger about delayed gratification. That they did his name was Michel, and he did a research study, I think at Stanford, with kids, where he offered them a marshmallow, set it on the table, and said, if you wait and don't eat this marshmallow, I'll give you 2 marshmallows when I come back. And he would leave the room. And they determined that the kids that could wait for that better gratification later, when they followed up with them as adults, they were more successful in life. So that's a kind of example of longitudinal studies. They show patterns over time, and they're good at clarifying things. One of the problems with longitudinal studies is that you have attrition or loss of participants over time, a lot of times because they won't stay in the study or something happens. So controlling the study context, external factors are important to control. Constancy of conditions is where I've been talking about controlling those extraneous variables and making sure they're the same. Control over the environment, setting time, intervention fidelity, we've already talked about that, but in experimental research, you need a very formal protocol if this is what the intervention is going to look like. Participants. Again, randomization is the best. Homogeneity, which is a kind of an odd word, but that's where you want all of your participants to look very similar. So if you can't randomize, this is another good way to do it, you have your participants looking the same. Matching is where you make sure that a participant in the control group and the participant in the intervention group have the same characteristics. This gets difficult if there's more than 1 or 2 things that you're controlling for. And then statistical control. We're not going to get into that because it's deep, deep stuff that I still struggle with really understanding. But just know that that's out there. They can control things statistically. So characteristics of good quantitative research. You've got to have statistical conclusion validity. Internal, external, and construct validity. I'm going to let you read about these in your book. I want you to understand kind of what these are, but you don't have to have an in-depth understanding of these things. And then the rest of my slides go through different threats to validity. And you can pause this and read over these, but they're also in your book. So just know that validity is very important in quantitative research, that you're able to generalize this information, that what you do to the intervention for one person, you do to others, that the intervention is really doing what it's supposed to do, that it's measuring what you're wanting to measure. So this is it for quantitative. Be looking for my qualitative research lecture. If you have any questions, let me know.